First of all, welcome everybody to the National Press Club. My name is Ryan Gallucci. I'm the Deputy Director of the National Veterans Service with the Veterans of Foreign Wars. And we have an excellent panel here today to launch the VFW's mental wellness campaign. And basically, I want to just go over this real quick, just a couple of details. Our goal is to really raise awareness, foster community engagement, improve research, and provide intervention for those affected by invisible injuries and emotional stress. Now, what you'll hear in the conversation today is that the VFW has a long legacy of doing this kind of work, but we've partnered with some outstanding community organizations who have joined us up here today to really amplify the VFW's efforts. Before we get started with our panel discussion, though, I also wanted to acknowledge Dr. Caitlin Thompson here, VA's National Director for Suicide Prevention. Dr. Thompson was formerly responsible for managing the National Veterans Crisis Line and has been a longtime friend and collaborator with the VFW. She's repeatedly provided training to our organizational leaders and our service officers on the resources VA brings to bear in combating veteran suicide. Though today's discussion centers largely on the non-government collaborators that you see up front here joining us at the table, VA is right there with us in this effort. And I want to thank Dr. Thompson for not only joining us today, but for her continued collaboration and personal dedication to this issue. With that, I did want to offer Dr. Thompson the opportunity to say just a couple of quick comments here about mental wellness and her initiatives.
Thank you, Ryan. Hi, everyone. What an honor to be able to just briefly address you all in this fantastic panel. VFW is one of our strongest partners, and we are absolutely thrilled that that they have decided to really enhance their look at mental health and mental wellness, and to really continue to enhance the partnerships that we have. It is VA's top priority to make sure that we are partnering with all of the right people, including our nonprofit partners as well as our veteran service organizations, and VFW is in the forefront of that. So really want to thank Mr. Wallace and Mr. Duffy and, of course, Ryan for inviting me to step up here and enjoy the panel. Thank you.
Thanks, Caitlin. So you didn't come here to hear me talk. You came here to hear from our panelists. What I'm going to do very quickly is go down the line, quickly introduce who we have with us, and then ask them to give a little bit of biographical information, talk a little bit about their organization. First, to my immediate right is Brian Duffy, the current Commander-in-Chief of the Veterans of Foreign Wars. To his right is Dr. Barbara Van Dahlen, the founder and president of Give an Hour. To her right is Joan Demetriades, the Chief Strategy Officer of OneMind. And to her right is Jim Murray, the Director for Strategic Partnerships for PatientsLikeMe. So, Brian, tell us a little bit about yourself. Why are we here today?
Thanks, Ryan. And on behalf of the Veterans of Foreign Wars, I have the great honor of being the National Commander. And we're working this initiative this year together with our partners in the auxiliary to the Veterans of Foreign Wars. And why we're working it is really we are America's largest combat veteran service organization, and we bring boots to the ground. We bring the numbers. We have the numbers not only in membership, we're at 1.7 million combined between the VFW and the auxiliary, but we also bring the post, 6,600 posts and almost 1,800 service members. So we think we're a good fit to lead this fight.
Excellent. Thanks. Dr. Van Dahlen.
Thank you, Ryan, and I'm really honored, privileged, excited about launching this partnership. So Give an Hour is a national nonprofit organization that provides free mental health care to those who serve and their families and their communities. We've been doing that work for 11 years, and we're very proud of the partnerships we have with the VA and our VSO partners, MSO partners, and our other nonprofit partners. And that work of harnessing civilian mental health professionals and asking them to step up and give service, give their time to provide care, really led us a year and a half ago to launch the Campaign to Change Direction, because we realized that if we truly want to ensure that the men and women who serve our country and their families receive the mental health care that they so rightly deserve and sometimes appropriately and understandably need, we have to change the greater culture. Because as you'll hear us talk about later during this panel, unfortunately, there are still many, many barriers that prevent people from saying, I'm struggling, I have anxiety, or I'm dealing with depression, or I've come home with post-traumatic stress. So a year and a half ago, we launched Campaign to Change Direction. The goal of that effort is to change the culture of mental health in America. And a piece of that, which is so exciting, is we believe that our military and veteran communities can help us lead the way. And we'll talk more about that as well. And when Brian and I met, it was actually at the VA at an event, a suicide prevention event. And we talked about what we might do together to change the culture. And I said, you know, that would be an amazing opportunity, because not only would it be allowing us to reach those 1.7 million through the VFW, but also each one of those posts creates an opportunity to get this message out into communities so that we really can change our culture. So I'm proud to be here. Thank you.
Excellent. Thanks, Barbara. And Joan.
Hi, everybody. I'm Joan Demetriades with OneMind. We're a 5-year-old nonprofit organization founded by Napa Valley philanthropists Garen and Sherry Staglin when they teamed up with former Congressman Patrick Kennedy, a well-known mental health advocate, back in 2011, with the goal of really accelerating the diagnostics, treatments, and cures for all brain-related injury and illness, while eliminating the stigma that goes along with it. The first focus, however, was supposed to be on traumatic brain injury and post-traumatic stress, because they all felt that we have a national obligation to those who fought for our country to tend to those invisible wounds. How could it be any better than to hire in 2012 former Vice Chief of Staff of the Army, General Peter Corelli, as OneMind's first CEO. And General Corelli would love nothing more than to have been here today. I'm the substitute, and hopefully I can convey our passion and our interest in serving your community. And if possible, Joe, can we hear the remarks from General Corelli?
Hello, I'm General Retired Pete Corelli, CEO of OneMind and a 40-year Army veteran. OneMind is honored and proud to partner with the VFW and give an hour to help reduce stigma, contribute to research, and improve treatment methods for brain injuries. I extend my sincerest congratulations to VFW Commander-in-Chief Brian Duffy and VFW Auxiliary National President Colette Bishop for their leadership of this new mental wellness campaign. After 2 tours in Iraq and later as Vice Chief of Staff of the Army, I saw our amazing ability to save soldiers on the battlefield. It's imperative that we extend that quality of support beyond active duty and aggressively address the invisible wounds of war. Knowing that 20 veterans take their own lives every day is tragic, especially when less than 1/3 of them were enrolled in the VA. That is why it is so urgent for us to quickly find better and lasting treatments for those who are affected and suffering from brain injury and illness. Having the best mental wellness programs still requires someone to first ask for help. It takes all of us in every community to ask not just how someone is doing, but to ask how someone is doing today, and to be able to tell them what referral resources are available locally. We look forward to VFW and our auxiliary members participating in the online communities we are offering to better understand and improve their brain health. Thank you to all who have served this great country, and to those who advocate for their rights to better care. Thank you to those families and caregivers who provide support daily. I admire your strength. Last but not least, thank you, veterans of foreign wars, for creating a sustainable campaign to raise awareness, foster community engagement, improve research, and provide intervention for those who are suffering.
Outstanding. Thank you, Joan. And last but not least, Jim Murray from Patients Like Me.
The guy that gets to follow the general. Jeez. Hi, good afternoon. My name's Jim Murray. I'm the Director of Strategic Partnerships for Patients Like Me. Patients Like Me is an 11-year-old company based in Cambridge, Massachusetts, and it's an online research and resource for patients to utilize, patients living with chronic conditions. Patients to learn about their chronic condition, to connect with others that share a similar condition or treatment, therapy, etc. And then also to have the opportunity to longitudinally track the progression of that condition. In the process, these patients are sharing information about their journey. We refer to it as data donation. These patients are contributing to long-range research which impacts the development of services and products that can benefit them in the long run, as well as people following in their footsteps with the same chronic condition. We have the opportunity to change healthcare if we unify and come together as a solid unit. And we recognize that much of the research and studies that we've already conducted in mental health over the last 11 years could be utilized and benefited by many veterans, as well as a growing population. We have now over 90,000 members just in the mental health community, over 400,000 spanning 2,500 chronic conditions. And we look to utilize the peer-to-peer support that's already shown beneficial to our members. And certainly it makes sense that we would want to partner with some leading organizations that can bring this to the forefront. It's a common goal of all of ours up here, and I'm pleased to be here today. Thank you.
Thanks, Jim. So a little bit about how this is going to work. So we're going to have about a little bit about half-hour discussion, some guided questions for each of our panelists, and then we'll open it up to the floor for any questions that you may have regarding the VFW's mental wellness campaign or anything that we may have talked about. So to kick this off, I'm going to go right to Brian. This campaign is the National Project for You and VFW Auxiliary National President Colette Bishop. I wanted to ask you, why now? What inspired you to commission this campaign?
Well, you know, I believe in the video that General Corelli presented in the opening here, I think he summed it up. He said there's an urgency, and there really is an urgency. The Veterans of Foreign Wars, coupled with our partner organization, the Auxiliary to the Veterans of Foreign Wars, we've got a storied history of service to our veterans, service to their family members. So I think we're well suited, and especially when you look at the makeup of our membership, that many of them are combat veterans. Certainly all of them are veterans that have put themselves in harm's way. We bring to this fight not only the numbers that I spoke about earlier, but we also bring to the fight the fact that we know in shedding mental health awareness, we know that veterans are more likely to talk peer-to-peer about some of the issues that they're facing versus talking to the general public. We know that 80% of the more recent veterans returning cite that they don't believe that the general public understands their issues. We also sadly understand that that same number, 80%, say that it's a shame and an embarrassment that prevents them from perhaps seeking out the mental health care that they know. And you know, all those things at some point, all of our members, wherever they earned their eligibility to the Veterans of Foreign Wars of the United States, all of them at one point were young. All of them at one point were on the pointy end of the spear. All of them know firsthand what it means, no matter what generation, no matter what we called it back then, whether it was shell shock or PTSD, they all know those challenges. So we bring an organization that has a lot of resources, not only the physical, the brick and mortar, but the folks themselves, the 1.7 million members. So I think we're ideally suited to partner up with some of the organizations that are up here to lead the fight.
So as a quick follow-up to that, we've talked a lot about the resources that the VFW brings to bear, but this is working with our auxiliary. What's unique about the auxiliary and the auxiliary's membership that they bring to this fight as well?
I think, quite honestly, when you look at the auxiliary, first of all, when we talk about mental health awareness, it doesn't just affect the veteran that went off to war, it also affects that family member. So if the auxiliary member is a spouse or a family member through their eligibility that got them into the auxiliary, they themselves may be suffering from some sort of a mental crisis in that. So they know also firsthand, but they also know from the caregiver side. They also know that veteran that they perhaps have at home, their father, their husband, their wife, whatever that veteran relationship might be. So they also need the same resources that we're trying to muster up, again, with our partners here to help lead the fight.
Exactly. So to Barbara, why was Given Hour so eager to sign up and partner with the VFW on this effort?
So for us, I mean, there's, I guess, two major pieces. One is, Given Hour's mission has been since the beginning to provide free mental health care to those who serve and their families and their communities. So we've always looked for great partnerships and have thankfully been able to develop them over the years. Why this partnership is so powerful is that we are in the business of providing care and changing culture. In order to change culture, you need boots on the ground. You need people who are in communities who speak the language, in this case, a very simple language of recognizing those signs of emotional suffering that we can all learn, just like we know the signs of a heart attack. But it also needs to be people who speak the same language because they've shared something in common. They've shared the experience of being in the service, of coming home. The other reason that I personally was so excited to join this, I want to give another shout out to Brian. When we met at the suicide prevention conference and we were standing there talking about what we could do together, he said something that was so powerful in terms of the vision. We were talking about the numbers of suicides in the military and in the veteran community, and that people often misunderstand that number of 20 a day. Now we know, thanks to the VA, they're tracking this data. People often think it's the young veterans, it's those 20 or 20 young Iraq, Afghanistan veterans. And Brian and I were talking about, no, it's actually 65%, right, Caitlin? Are ages 50 and older. So Brian said to me, if we don't do this right now, when these young men and women reach 50, it's going to be another wave, won't it? And I said, yes, sir, it will. That's why it was so clear to me that this was going to be a great partnership, because he gets the now, he also has the vision, and he's bringing the VFW, and the auxiliary has come right along with it, because we recognize the importance of this work, not only for this generation, the 50 and older today, but the 50 and older tomorrow and all the ones in between.
Exactly. I think you hit it on the head with everything about changing culture. And I did want to ask, you mentioned the campaign to change direction and the 5 signs of emotional suffering that we've all highlighted. We have some of the cards here in the back, and Brian has one, I have mine in the pocket. But can you tell us a little bit more about how you see the VFW playing a role in that larger campaign to change direction, not just for the veterans population, but for the general public?
Sure. So there was a time, I don't really remember it because it must have been when I was a kid that I learned the signs of a heart attack. I don't remember when that was. I don't remember how it happened, but I sort of have always known them. So if we were sitting here today, as we are, if anyone in the audience started to complain of chest pain, started sweating profusely, said their arm hurt, we would all look at each other and say, heart attack. Now, they may not be having a heart attack. They may be having a panic attack, actually. But it wouldn't matter. We would know that somebody was hurting, and that it means it's time to do something. We would take action. So this is a public health initiative. It's not a mental health. It's a public health. We want everyone in the country to recognize just these 5 basic signs. There's a lot more of them that tell us that somebody is depressed or anxious. This isn't about diagnosing. It's not about judging. It's not about labels. It's recognizing when people are hurting. So who better than to enlist these amazing folks who are connected to the posts all over the country, give them that basic information. I had the pleasure with you. I did a wonderful training of some VSOs that the VFW was working with here in Annapolis. And I came in and I talked about those 5 signs. Man, woman, they came up to me over and over again saying, this is so helpful. I get this. I can give this. I can teach this. I can train this. It's simple. It's basic. But we literally need people on the ground in communities all over the country, spreading the word, not only in the posts, but to the communities that they are in.
So just a quick follow-up on that to Brian and Barbara. We already have a collaboration in the works between VFW and Given Hour to get out into communities and foster that engagement to change direction on mental health. Can you talk a little bit about that initiative that's coming up?
Yeah, thanks. October 8th, we're asking our members of both the Veterans of Foreign Wars and our auxiliary, to get together with folks in their community to learn the 5 signs that Barbara talked about, and at the same time to get out there and do what the Veterans of Foreign Wars and the auxiliary does best, community service. You know, we often refer to us as VSOs. We are a veteran service organization, and the product that we have is service. So in tribute to our program with the mental health awareness, we're asking our members to couple up with the partners in your local community, with your auxiliary, do a project out there in tribute to raise that awareness of mental health, and at the same time learn those 5 signs. I had an opportunity, Ryan. How do you measure success of this program? I related to some folks earlier. You know, we just started this initiative, and already I had 1 VFW member and 1 auxiliary member come to me, and they brought me to the side 3 weeks ago during a meeting at a local VFW post. And they told me just an incredible story, which tells me that we're fighting the right fight. They told me that they had a veteran that was in a dark area, and that they provided that veteran not only conversation, because that peer-to-peer is so important, but they also provided that veteran some literature that they had available. That veteran went home and was still in a dark area, went downstairs and got their pistol out of the safe and came back upstairs to the kitchen, put the gun down, and picked up the literature. And the next thing that veteran did was pick up a phone. So I know the Veterans of Foreign Wars and our auxiliary, coupled with our partners up here, can make an incredible difference. And even if it's saving 1 at a time, or even if it's just making that mental health awareness with everybody, something that we can all talk about.
That's excellent. I think that brings us to a good jumping off point to talk with OneMind about this, destigmatizing mental health, mental wellness. So to Joan, why was OneMind eager to partner? We heard General Corelli talk about it a little, but from your perspective, why was OneMind eager to sign on?
I think both Brian and Barbara touched on it. The recognition that we can quickly raise that awareness, get the culture change moving by tapping into your members. You've got a system in place that really allows you to get to a lot of people and friends of those people and relatives of those people. And the research that we all want to really find these cures takes a long time. So what can we do right now? And raising awareness and getting people to ask for help is what we can do now. In the research area, what we're also finding is that when individuals learn that the cause of some of their symptoms is really from true injury to their brains, it helps to destigmatize and helps people to reach out for help, because it's not a moral failure. It is a physical injury, and the leadership shown that is saying we need to tackle this now, we need to get to this now, as we foster and develop new diagnoses, new ways of imaging, new ways to improve care. We think we're hitting things in parallel trajectories. And part of our real interest is that it could happen quickly and be sustainable. This concept of it will continue beyond this year was really a big draw.
And so there's, to follow up on that a little bit, in some of our past conversations, there's something very unique about what OneMind is trying to do, and it relates to the urgency of mental health, mental wellness, brain health in the veterans community. Can you talk a little bit about what OneMind is trying to do to open up access to data, to research institutions, some of the ways that academia and the medical community have interacted in the past? Can you talk about that a little?
So that's really another kind of foundational principle, that the illnesses of the brain. The brain is so complex that no one group in any one institute or any one university can solve these problems. The only way we're going to truly accelerate this is if people work together. There's fabulous work that's being done. The VA has done fabulous work. The DoD does fabulous work. But it's almost impossible to bring it all together in a way that will prevent redundancies of studies or will make things happen faster. Brain research is perhaps where cancer research was 50 years ago. How can we learn from what has worked there so that it doesn't take us another 50 years to figure out the illnesses and injuries of the brain? I think that when we talk about data sharing and collaboration, that's changing another set of another cultural and requires a lot of changing the incentive systems to universities, to even individual researchers, because many of them are rewarded on their individual achievements. So what we're trying to do is foster a collaboration cross institutions, and the way we help to do that is by supplementing the funding that they get publicly through NIH or other agencies to, again, encourage the collaboration, discourage doing it only in their own institution, and then by doing so, really making things happen faster.
I think that's an interesting perspective, too, and it speaks to the warrior ethos that's so ingrained in the veterans community. It almost makes sense that it's happening in the context of the veterans community first, where we put the mission before individual success. So I think that's excellent. And it was actually through OneMind that we came to learn of our last partner here, PatientsLikeMe. And so to Jim, I wanted to ask, tell us a little bit more about PatientsLikeMe. What makes this platform unique, and what PLM sees as an opportunity to work with the VFW?
Thank you, Ryan. Excuse me. PatientsLikeMe brings the patient voice to the forefront. PatientsLikeMe, as I said earlier, allows members living with chronic condition to learn about their condition, to better understand what the symptoms that they're feeling are all about, to start answering questions that they're hit with every day. Is what I'm feeling normal? Is what I'm feeling my new norm? Is this what I've got? We have members connecting with each other and pulling each other up. The peer-to-peer support that we have has an obvious role here, I think. Our members, our veteran community that we've been studying for a while now, have already indicated that. Several studies that we've done across the veteran population as well as non-veterans with post-traumatic stress and traumatic brain injury have indicated some of the leading symptoms that they would like the most help with go untreated. And as we've heard earlier, often go untreated by personal selection, personal choice, because there's no desire to be labeled as someone with a psychiatric problem. So PatientsLikeMe is an otherwise safe venue for people to come together and lift each other up, to learn about their condition, to support each other, and then if they choose, longitudinally track the progression of that condition. In turn, they're donating some data about their personal experience to the greater good of research. When we start sharing data about ourselves, we're no longer an individual. We allow global innovation to occur. We allow for changes in products and services to occur at a much faster pace than it could if we were all just one person. And when we make those changes at the rapid rate that we're already seeing, we start to see healthcare change. And if we can make that change beneficial for veterans, it can be good for everyone. So we're thrilled to be working with veterans organizations, not just veterans of foreign wars, veterans all over. We're looking forward to telling our communities about veterans of foreign wars. We're looking forward to telling our communities about Give an Hour. And we've been working collaboratively with OneMind for several years now to try and better understand these communities, to try and better understand the symptoms, to try and better understand the treatments that people are, up till now, tending to on their own. We understand, and everybody in this room understands, that the unit is stronger than the individual. So PatientsLikeMe, through the peer-to-peer support, brings to the table here something that I think is a unique offering. There's places that patients can seek solace and camaraderie. But as I heard from one of our first patient advisors last week, a military veteran, a Patients Like Me member for several years, and a successful officer in the Air Force before retirement, that when she'd been diagnosed with a life-changing condition, it changed her life abruptly. And there are things that her doctor told her, and she was a professionally trained clinician herself. What her doctor told her, what her own common sense and training told her, what her spouse, who's also a trained clinician, told her, paled in comparison to what she heard at Patients Like Me from other people with the same condition. That she no longer felt alone, that she no longer felt the stigma and the isolation that came with that condition. So we're thrilled to be working with VFW, Give an Hour, and OneMind.
This is all outstanding. I hope what you'll see is that there's consistency in a lot of the way that the VFW has approached these different resources. It's not one size fits all for any veteran in how they engage in this discussion or even the resources that they bring to bear. I think what Jim is talking about here is if you're not comfortable in the peer-to-peer, face-to-face environment, there's a place that you can go to share that information and find people facing similar challenges. To move on just a little bit and really open up this discussion, I wanted to ask to all of the panelists, what are some of the challenges that you see in the veterans community that you're looking to address through this campaign? So whoever wants to tackle that one first, kind of broad, I'll just throw that one out there.
Could I jump in with a quote, actually?
Sure.
A quote from another member, and there's thousands of stories. Some of them are incredibly moving. But we have a military veteran. It's been a Patients Like Me member with post-traumatic stress for a couple of years now. And Trevor had indicated that at the point he found Patients Like Me, he was on the edge of suicide. And he said that it was other veterans on Patients Like Me, other people living with post-traumatic stress and the symptoms that were his everyday. And his everyday, by the way, were 5 to 10 episodes. Let's call them aggressive outbursts. And since finding Patients Like Me, his life has changed. So some of the challenges that we continue to look to tackle are overcoming the cultural norm to spread the word that it's okay to reach out for help. But we also see through our veteran observations that there is a huge, huge willingness to help a fellow veteran. So we're very interested in the tone in which we take. We're very interested in rallying all of our members. We see a huge amount of communication from veteran to civilian and back again. The help across our platform is not isolated to any one community. And we see that the strength across hundreds of thousands of members is enormous.
I think also from the veterans community, the challenge that I see that the VFW and the auxiliary face is convincing veterans, convincing the family members that the shame and the embarrassment that they may associate with mental health challenges is something that they should walk away from, that there is no shame, there is no embarrassment, that the stigma of mental health issues is something that we will have to work very hard on. But the more we speak about it, and Barbara spoke about it, or Joan may have spoken about it earlier, the more we speak about it, we will see a morphing in a similar way that we did with cancers, that in one time, not too long ago, we wouldn't talk about cancer. We certainly wouldn't talk about, as I call it, the personal cancers. Mm-hmm. And now we are. And because we are talking about it, we're having people saving their own lives, saving others' lives. So I think in the same way, the challenge I see for the organization, the VFW, and the auxiliary is working with our membership to understand that the stigma surrounding mental health needs to go.
Mm-hmm.
I was just going to say, I think that a piece of that is, people often have such misperceptions and ideas that are inaccurate. They really don't know some basic things that if we do a good job of getting information to them in a way that they can receive it, that we're seeing that is changing dramatically people's reactions. When we go out and talk about why is it important for everyone to pay attention to our emotional well-being? Well, because we all have it. Why is it important for us to all pay attention to mental health? Well, we all have that too. And when I do presentations, we had the honor of doing a statewide event in New Hampshire, and we had some of our VFW friends with us at that wonderful event. And the governor was there, senators were there, congressmen and women were there. First responders, teachers. It was 400 people in the State House to talk about Change Direction New Hampshire. So I'm talking about my family history and my dad who served and my mother who was schizophrenic. And then I said, so if there's anyone in this room who has not been touched by mental health, either you yourself or someone that you love, raise your hand. Nobody ever does. And what's really cool, I always know that. I know that nobody's going to raise their hand, so I can, I'm really like, it's kind of a little surprise that I know is going to come, because what happens is people look around like this. They're like, you can see on their faces, it's not just me. It's not just me. And then people come up afterwards and tell me their son committed suicide, their husband had this, they themselves struggled with an eating disorder. And it's like this desire to exhale. Me too. Patients like me too. We are part of this. So doing that, giving people that basic information so that they can be free to acknowledge, that's both the challenge, but it's a tremendous opportunity that we're seeing with our partners. VFW, also the VA, is helping us, again, not just in the walls within veterans and veteran families, but also into communities. It's a huge opportunity.
So you could say that veterans are, once again, leading.
There you go.
Just one quick comment. I think that one of the challenges is the challenge of weakness, and that's one of the easiest ones to overcome, because the more we all talk about how it's truly a sign of strength to ask for help or to recognize that you or a friend or a colleague needs help, that it's from a position of strength that will catapult this really forward.
Absolutely. So, Jim, I did want to ask, you brought up an interesting term. I want to see if you could go into a little bit more detail about this, but data donation. It's something it's a term that really sticks out to me, and in some of our past discussions, I think would resonate with the veterans community, with members of the VFW, about what they're actually doing when they engage on Patients Like Me. Can you talk a little bit about that, or how you came to that specific term?
I'd be happy to. It's often easiest, I find, with various audiences to grasp what data donation can mean if I draw an analogy to blood donation. It's something common in our community and service now. Many people repeatedly donate blood on an ongoing basis, and they do their civic duty and move on with their life. We all have that same opportunity with data and information about our quality of life, our condition, our comorbid conditions, our treatments, our therapies, what's working, what isn't working, what dosage has a better effect and allows me to get out of bed in the morning, what's had an impact on the relationships in my life that matter most. All of those personal experiences, when we pull them together, has so much strength to change the marketplace, to change healthcare for all of us. So the idea of data donation, each of those data fields that I've exemplified here, goes into Patients Like Me, and it helps each individual and empowers them, educates them, allows them to have a more informed dialogue with their clinician, their doctor. It helps everybody else on the platform then as the process. And each of those data points then, through our partnerships in healthcare industries, allows, as I've said, for advancements in products and services and ultimately healthcare.
Joe?
So one of the reasons that OneMind started working with Patients Like Me a few years ago was because in the R&D world, we've been talking about patient voice and having the patient be the center of all treatment. We talk about personalized medicine. There's a lot of talk about these things, but often we don't actually gather the direct information from patients. And the platform Patients Like Me is already set up to do that. Individuals may feel more comfortable doing something electronically, or just by the fact that when you're sitting in front of your doctor, you don't necessarily remember all these things. You don't have the time anymore to express it. So how, what a wonderful place to be able to start to gather true patient input and get it directly. And that was part of the appeal for OneMind, to partner with Patients Like Me and to begin to build up and gather feedback. Jim mentioned asking membership, what symptoms are not being controlled? Well, that may be very different, and that's part of the just the strength of that platform.
Absolutely. So I wanted to get into a little bit more of the meat on this campaign. And another general question, open-ended, take it wherever you want to go with it. But to all of the panelists again, what are some of your objectives for this campaign, both in the short and the long term? So whoever wants to jump in there first.
Well, for us, I mean, ours is pretty darn simple. We want all Americans to know those 5 signs. That's the big sort of, and behind that or with that or next to that or piece of that, the culture change, so that people talk as openly as we do now about cancer, about other conditions. Oh, you know, I have a rotator cuff issue right now. I actually do. I have to get a cortisone shot. I'm not looking forward to it. But I know from talking to people that, and my doc, who I trust, that it's going to relieve the pain, and then I can do physical therapy, otherwise known as torture, and then I will be better and I can go back to swimming. So that's my sort of little story about my own physical. So we want people to be able to talk the same way about their emotional well-being. You know, I came back, I saw some really bad stuff. I lost some people I cared about. I can't sleep. I've got flashbacks. I'm yelling at my wife or my kids, or I'm crying all the time, or I'm drinking too much. We can get there because there's no difference. One is the physical part of me, one is the emotional part of me. So that's our long-term, short-term, and sort of all. And with Caitlin sitting here, I would say that one of our other goals is to support, encourage, lead, take more and more people into care, so that they're getting the care and support they need and deserve, our veterans, and also in communities. Last thing I'll say about all of this is people often in communities, especially the healthcare folks, it's fascinating. They'll get a little, and I'm a psychologist, so it's my tribe. They'll get a little anxious and they'll go, what are we going to do if more and more people start saying, I need help? And I'm like, as opposed to just telling them, be quiet. Like, it's sort of like, well, yeah. And the point is, it will be disruptive because more and more people earlier, but we know that early intervention is far better than waiting till people are in crisis. We know that prevention itself is doable and possible. We know that. So it's okay that it's disruptive, but that's, I guess, a sort of an intermediate. It's not a goal, but we know it's going to happen. But with great partners working together, including like our faith-based community, so many groups are out there that will step in, peer-to-peer support models, technology. And the last thing I'll say is we believe that changing the culture will drive more money to research, so that those kinds of dollars that need to be spent to understand bipolar disorder, post-traumatic stress, schizophrenia, will be more a priority in our country.
You know, I'd like to see the VFW post in particular be seen as a base camp, as a hub that has the tools and the resources readily available to help anybody in the community, whether they're veterans or not veterans, deal with the mental health challenges that they might have, to make sure that veterans in particular understand that there is a beacon in their community that they can go to have that peer-to-peer conversation if that's what's needed. So that's what I would hope that the VFW members, and, you know, it's not just the VFW members, not just the auxiliary. The fact that we have so many members out there, the fact that we have so many posts out there, we can be a force multiplier in the community. The more that we bring the community into these training sessions, these opportunities and that, the more effective we can be as an organization, as I say, as a force multiplier, to help answer some of the questions and answer the call of, especially again, our veteran community's needs we are a service organization, and it's a service we can provide.
And in some way, that peer support is nothing new to the VFW. We're just beefing up our resources to do this.
Absolutely. And one of the areas that we've got a long history on is we have professionals out there in the communities at over 20 major military facilities and 16 to 1,700 throughout the organization. We call them veteran service officers. Those are the professionals that day in, day out deal with veterans that come in seeking information on available benefits and that. And quite often, one of the issues that they bring in has a direct nexus to a mental health problem or challenge that they're dealing with. So again, going back to what I initially said in the beginning, we bring the numbers, we bring the boots on the ground to this fight.
And as the overall voice gets louder and louder and louder, the whole country, the public health benefits, and that's where I think we're most gravitating toward that. How do we really help everybody? And ultimately, it makes everyone more productive. It makes the life a much more enjoyable experience. You're more able to enjoy the work you do. It's only good. And the fact that this can really multiply it by 10, whether it be speed or numbers, I think is just an awesome opportunity.
I think you bring up a good point, and this kind of jogged something in my memory here real quick, was to think about the Boston Marathon bombing and the advances in prosthetics technology that happened as a result of polytrauma injuries from the current conflicts. And I almost hate to draw the parallel, but we have a similar opportunity with military mental health or mental health in the veterans community to really make an impact on larger society. And I think that's some of what this collaboration is looking to do. All right. One more question, and it's really to leave this off on a good foot before we open it up to some questions from the audience. What can the veterans community or the public do to become involved in this?
If I may. I think that at Patients Like Me, we're counting on so much of what's already right. You know, we've been talking about culture and shifting the dialogue, but so much of the culture in the veteran community is already right. I've heard time and again from conversations with veterans that regardless if it was training, or if it was combat, or if it was before serving or after serving, that there was always an understanding, an unspoken acceptance that someone was there by your side to lift you up. So I think we're counting on VFW to be those leaders again and again and again, because so much of what's already present is integral to this overall cultural shift.
I mean, I hadn't thought of this before, but as you were speaking, you asked, what can veterans do? What can family members do? We all have to own it. It's great to say we're going to do this at the post, and we are. Lots of them, lots and lots and lots of them. And I really want to give the message that it's on each of us to do our individual part, whatever that may be. If it's sharing your own personal story, if it's encouraging other people to get involved. But that's, when I think about what this is going to take, that's what it's going to take. Everybody has to do their part personally. We can do a lot organizationally, nationally, and we are, and we will, and we'll bring in all of our partners on messaging and coordination. But then it's up to each individual person. This is one of our ads from Time Magazine, Know the 5 Signs, some of our partners, champions. If you listen to the PSAs that we've done, and it was eloquently stated by the First Lady at our launch event, then it's up to each of us to reach out, connect, show compassion, offer to help. The message is, it's about each of us. If we do that, we'll get there.
All right. With that, I think we'll open it up to anyone who has any questions for our panelists.
As non-government partners in this battle, just what are the VA and DoD doing well, and what could they be doing better?
I'm happy to. I love talking about what the VA and DoD are doing well, because they so often get slammed in the press for what they're not doing well. What we've seen, and I can only speak to Give an Hour, but also what I've observed, is really a willingness and an interest in partnership. And it's not always easy, and people, I think, assume that, well, if you want to partner, just go ahead and do it. But these are huge institutions with huge structures of leadership and management, so it's not always quick. But it is happening in new and different ways, more and more sort of accelerated, I would say, for us in our work over the last 6 years. We've seen a tremendous amount of progress, and it's great because sometimes it's, okay, we're going to do this. We don't know exactly what that's going to look like or how we're going to get there, but we're committed to doing it. And more openness about what isn't possible. When I first started Give an Hour 11 years ago, neither one of those things were in place, neither the transparency, because sometimes the best answer is no, or no, we can't. But also that willingness and that interest, and that right now is what I think we are all feeling a sense of urgency to keep that going.
If I could, one of the other areas, I think, from the VA standpoint, when we decided to go down this road and have this project, one of the areas we felt that the VFW and the auxiliary could be effective in is using our brick and mortar and opening up our post halls of that and bring in professionals, subject matter experts. And I can tell you right from the beginning, Secretary McDonald, Dr. Shulkin were right there with us, offering us the community outreach programs of the Veterans Administration. Because they also realize no matter how many VA medical centers, no matter how many CBOC clinics that they have out there, again, a force multiplier with the VFW post and putting veterans and community perhaps in a setting that is more comfortable to them and matching them up then with the professionals can be very effective. So in that area, I think the VA system has been very supportive.
I think as General Corelli mentioned, there are how can we quickly get what is best practice coming out of those institutions into the general public so that we're not reinventing the wheel, but we're actually able to almost hand over state-of-the-art treatments to more local practitioners. And if there were previous regulations against sharing data, how can we de-identify or anonymize information so that data can actually be combined with other things to more quickly propagate those treatments into the general public?
If I could add, I agree with Barbara. The willingness to entertain public-private partnerships is refreshing. The idea that there's already technologically advanced, innovative rather, means to reach a veteran population, the fact that there's already psychoeducational material disseminated amongst these communities does nothing for the idea of listening to the patient voice. So the idea of Patients Like Me serving as a potential listening post of sorts, being able to bring the patient voice, the veteran voice, to the forefront of not only research but also care is a refreshing thing to hear.
Is this on? Yeah. So I'm Patricia with Military Times, and I had two questions. One is for Patients Like Me. I'm trying to figure out how many veteran members you have at this point, and how do people reach out to you to become a part of your organization as a patient. And then the second one is, a couple months ago, we were all at this very facility talking about a couple of surveys that went on with the Bush Institute and Edelman, and we talked about the Change Direction campaign. And immediately afterwards, someone, a veteran, came up to me and said, what do you do after, if you know the signs? We know people are in crisis. And in the last couple of months since then, I've had two people come to me and say, you know, I have a veteran who's in the hospital right now in crisis, does not want to go to the VA after he gets out. How do you help somebody, you know, not just in regular mode, go get help? How do you help somebody in crisis mode if they're not willing to call the crisis line or go to the VA?
So I tackle the first two, and then everybody gets the hard one. Okay. So as far as the number of vets, there's a little bit more than just a number behind that. So we started working with OneMind just about 2 years ago now at this point. That was with a concerted effort to build out post-traumatic stress and traumatic brain injury communities on a platform that already had upwards of 2,500 chronic conditions represented. At the time, we had upwards of 325,000 registered members, and now we sit just over 440, I believe. So as far as the number of veterans, this ties back to what we ask of our members. We ask our members to share as much about their health journey as they're comfortable sharing. About the same time we started working with OneMind, we, for the first time in what's now almost 12 years, allowed our members to self-identify as veterans. So over the last 2 years are the only 2 of the 11 years, almost 12 years, where we've been tracking that information. Growing that population over the last 2 years, we have in the neighborhood of 5,000 that have self-identified as veterans. We know through behavior of many of the other members, and there's over 22,000 now with post-traumatic stress and traumatic brain injury, just within the last 2 years of effort. We know from behavior of many of those other members that they too are veterans. They've chosen not to self-identify. We continue to grow out these populations. We continue to, through partnerships like we're here today representing, seek to grow those communities on our platform. As far as joining Patients Like Me, partnerships such as this is a huge way of spreading word like that. We work across many different channels, healthcare systems, nonprofit organizations, payer communities, but the clinical setting is a great way to gain access to few patients. Organizations with this trusted brand and this length of service is a far more impactful way to reach a large population.
All right, we have a few minutes left, so I wanted to let the panelists. Oh, no, sorry. Yeah. Oh no, I was gonna. Yeah, I was just giving a little bit of a warning to our panelists before they got a little too.
So I just want to answer. I mean, it's a, as you know, very complicated issue. I mean, mental health care in our country today, I think it's somewhere between 6 and 10% of the funds spent on healthcare globally, not globally, nationally, go to mental health. That's a teeny-weeny percent. So our mental health care service delivery system in our nation is not where it needs to be. One of the things that we feel very strongly about, there's a wonderful psychiatrist, actually, in India who talks about mental health for all by involving all. That's where we're heading. There aren't enough mental health professionals right now in the VA to meet the needs, in the communities to meet the needs, not just for veterans, but across. And so one of the things we need to do is to change culture around identifying how to get people in earlier to all kinds of care. Primary care docs, pediatricians, faith-based, educating them, because there's a lot that we can do to get to people, support people, care for people, and yes, triage to people who are in need to the right kinds of services, but it's a system-wide challenge right now. If you just look at psychiatrists in our country, it's very difficult, whether you're a veteran in a community or just a regular civilian who's looking for a psychiatrist to find, let alone a child person, let alone a child psychologist like me. So we have to change our culture. We have to change the broader system because they are not, it's not yet, we're not anywhere close to being able to meet the needs, but we're also not tapping or coordinating or connecting or encouraging collaboration in a way that we need to maximize what we do have. That's not an immediate answer for that veteran who says, what am I going to do? I do know the answer to what am I going to do if I know these signs. There's lots of places you can go to get help if you know those signs. Somebody who's in a crisis and can't get plugged in into an inpatient bed or an inpatient unit, again, there's more work we need to do to make sure that every person who wants or needs care gets there, but this is the only way that I know to do it. We've got to change the system from within the system.
And I think from the VFW standpoint, from the auxiliary standpoint, if I had a veteran come to me with that, I would have to know myself what's available in the community. If they have a reason that they personally don't want to go to a VA medical center, are they aware of great programs like vet centers? Vet centers do so much for veterans that are needing help in this particular area. Make sure they're aware of that. Make sure they're aware of, as Barbara said, the faith-based opportunities that might be in your local community.
And with that, we have just about 1 minute left. I wanted to thank our panelists today for this discussion. I also wanted to thank Dr. Thompson and VA for joining us. As we leave you, did we have the second video?
Try to show, just to give you an idea of another champion who's involved in this work.
Well, it was
what you would have seen if it worked, but it doesn't. Is Prince Harry has done a PSA for us around, and you can go to our website and watch it, changedirection.org. What's so nice about it is Prince Harry, himself a veteran, is talking about in this PSA that veterans can lead the way as we change direction. So go to the website, changedirection.org, and take a look at it. It's a very moving piece from him.
So once again, thanks to our panelists. I did want to let everyone know that we have some of the collateral materials for the campaign in the back of the room. The Know the 5 Signs cards from, oh, it looks like we have the video.
Oh, hallelujah.
And we don't. It's because Apple and PC still in the year 2016 don't talk to each other. So in the back of the room, we do have the collateral resources, the Know the 5 Signs cards that we developed with Give an Hour, as well as a mental wellness campaign brochure. And in this, you'll also find the 5 signs, but also some resources to find help. So if you find a veteran who is in crisis, some places where they can turn, whether it's the National Crisis Line from VA, VA Medical Centers, Give an Hour providers, SAMHSA, some other resources to help learn how to be an advocate and how to intervene. So once again, I want to give a round of applause to our panelists.
Thank you.
And thank you.